So at the end of the day, you know, what we're trying to help physicians understand, and this is a critical opportunity, folks, is that it's really not about, you know, us and the technology, and it's really not even about the funding and the help that they could receive to do it. It's why we're doing this. So many physicians are challenged from the standpoint of the government programs, are concerned about them in terms of publicly funded health care. We have a mission, a duty, and a responsibility to really help physicians see why we're doing this, that it really is about the patient. It really is about the patient outcome, and it really is a focus is to be able to help them see that as they're applying this technology, it's not only going to help the efficiency of their practice, it's going to help their patient care. So with that, that's my story, and I'm sticking to it, Michael.
Thank you. Thank you very much, Walt. And just would like to remind people that are online that submit your questions through the Q&A function, and then we will answer them a little later in the program. Now I'd like to introduce Michelle Russell, who's the Senior Director for Business Development for Health Choice Network in Miami. Michelle has 2 degrees in information technology, 15 years of health IT experience, with 10 of those in federally qualified health centers and health center controlled networks. Michelle was recruited by Kevin Kearns and joined, he's the CEO of Health Choice Network, and joined Health Choice Network in 2002. Over the past 10 years, she has held ultimate responsibility for overall software implementations for Health Choice Network's 33 member centers and approximately 700 providers, including practice management systems, electronic health records, electronic oral health records, and fiscal systems implementations. And with that, I'd like to introduce Michelle Russell.
Thank you. Good morning. It's a little close. Again, very, very similar to what you've heard the gentleman here say today. I'm with Health Choice Network. We are health center controlled network. Very proud of what we do for the community, for the providers, but ultimately for the patients. Our mission is to serve the health centers, which include the federally qualified health centers, rural health centers, free clinics, community mental health centers, and homeless health care centers. We're currently in 9 states. We range from Rhode Island to Florida, all the way out to a health center on the Big Island of Hawaii. We serve other health center controlled networks in addition to individual health centers in those states. Today we have a health center controlled network specific to Florida. We have one specific to Utah and then one specific to New Mexico, which is a little different model than some of the others because they're not individual health centers. They're actually additional health center controlled networks. We have, today we serve over 700,000 patients and we see 2 million visits a year. When the health center controlled networks were formed, you had to have 3 areas of integration. And here we have, today, we have 6 different areas that our health centers are integrated. We started that with finance, managed care, and information technology. We've moved probably further on the information technology side than we did any of the others, but we provide CFO services for our health centers. We provide program services. We have a large program in the Miami-Dade area where we serve 79 public schools, and we have each of those public schools completely paperless on an electronic health record. So in addition to serving the federally qualified health centers in the areas, we're also serving the school system. We have several different committees for each of these integrated areas. Probably the one that is the most important to us right now are our clinical committees. So we have our medical directors who meet on a monthly basis and represent each of our community health centers today, and from the entire implementation of the electronic health record, along with our dental providers who also meet on a regular basis, and the implementation of the electronic oral health record. They're the ones who really make the difference because they come back with the best practices, the standards, what we need to do to improve patient care using that electronic health record. We also provide disaster recovery. We have all of our centers today, the data is hosted at Terramark, which is in Miami. And very similar to what Walt said, when you're in Florida, you have to watch for the storms. You have to watch for the hurricanes, which we just had tropical storm roll through last week. So the Terramark facility is a 5-9 facility, which means that its uptime is 99.9999959s after that decimal. And they are 100% power, 100% air. Because if your computer equipment gets too hot, it stops working. So our patient data is very safe in the Terramark facility. Our centralized billing office serves 15 different health centers in the state of Florida. So we do all of the AR collections, the billing, revenue cycle management from beginning to end for some of our health centers. And we also provide some managed care services. So we do credentialing, contracting for some of our health centers. We were also awarded a Regional Extension Center grant. So we have the South Florida Regional Extension Center, and these are some of our partners. Walt was dead on when he said, you can't do it without the partners. And it's what I find very interesting here is you'll see several hospitals listed, which is especially in the South Florida area, to get all of these groups working together so closely. It is phenomenal that we have all of these groups working in a partnership with us to make sure that we get our providers to meaningful use. This is a map of the 4 different areas of regional extension centers in Florida. We're the green area, the South Florida area. There are 7 counties right now that are still open. They've not been assigned to a regional extension center. So we're still looking to see where they'll head. And then the 2 other regional extension centers, other than the one that is run by the CHC Alliance, are run by the two major universities, University of Central Florida and the University of South Florida. So the meaningful use, I mean, we've said the words a lot, and I know that we've heard with the news, with everything that's out there right now, and how important meaningful use is. But meaningful use really is, just like we've been saying all along, it's ultimately to improve patient health care. And they have, the key goals are the same goals that as federally qualified health centers we've looked at for years. In the conferences, I could take each one of these key goals and discuss a conference that we've been to where that is the theme of the entire conference. So it really is about what we've done all along, which is what does position us to be in a perfect place to work with private physicians, hospitals, federally qualified health centers in our areas. Here's a little about what we're looking at for the Medicare incentive payments for eligible providers, eligible professionals. And for hospitals, hospitals can look at the Medicare and the Medicaid incentive funding. Federally qualified health centers and private physician offices have to look at one or the other. So we have to choose between Medicare incentive or Medicaid. And as you can see here, Medicaid incentive payments will sunset in 2021. Here's what we're looking at to achieve our meaningful use. I mean, first, we have to capture the data. So we have to do some sharing of data, some e-prescribing, some labs, eligibility and claims. But then secondly, we have to really start getting into true decision support in that second toll gate. And then in the end, of course, our goal is the improved outcomes. This list should look pretty familiar because it's very similar to what Paul showed. The final ruling for meaningful use. We feel today our health centers are on a common electronic health record. So all 33 of our health centers are on the same product. So our product meets each of the meaningful use rules that came out in this final ruling. And we do believe that once the certification happens, we're in an incredible place to be there, ready, already achieving meaningful use for our 700 physicians that are on the system today. Besides just the medical software, we also have electronic oral health records that The majority of our centers that have dental programs are on that system today. We have, our next goal is an electronic behavioral health care system, because what we have found is our medical system, unless you're looking at some very basic, some case management, minor counseling, it doesn't work for true behavioral health care. So we need something that will work for inpatient services. We need something that truly does what we need with a behavioral health care product. So what we're doing with each of those products today is interfacing each back to one common system. So we have one common AR, we bill out of one system, and we can get our federal reporting out of one system rather than try to pull it out of several. Some more on our meaningful use. We have the decision support today in place. We are able to provide the patient with an electronic copy of the information. Realistically, we have not seen patients asking for that today. We've seen them ask for it to take to another provider, but we're able to give that to them today if they do request it. I can see that becoming a more common practice for our patients. And really, again, the end result of meaningful use is improved patient care. It is about the patients, and that's what we've been doing for the 16 years that we've been in business, is helping our health centers get where they need with meaningful use before meaningful use was defined. Michael?
All right, very good, and thank you, Michelle, for your presentation. What I'd like to do now is start to go into some of the questions, and first open it up to the board and see if any members of the board have any questions. Then we'll go to those online, and then finally to the folks who were here in person. Kevin?
I'll combine kind of two questions into one because I think they're related to one another. But you guys have been in business a while, which is great, even before all of the money started flowing for the grants and other ways in which to fund various programs. So I'm curious how you've been able to create a business model that's sustainable, over the years, and have you found that changing over time because of maybe conflicts with now requirements of the regional extension centers or other things that maybe you weren't doing before? As an example, it seems like each of you guys have been providing to some degree technology either that you've built yourselves or that you partnered for, but now as in a regional extension center, one of the things you're helping do is select technology, but you're providing it as well. So is that creating a conflict for your business models that you've had in the past?
It really hasn't created conflict necessarily. I think it's positioned us better to be able to help those organizations either choose or implement. When we chose our electronic health record, we did it very similarly to the way that the others did, and we got our medical directors together and went through the selection process and went through everything that we, in order to choose the right product, because we were only choosing one. Where it gets a little more difficult now for us is we're looking to probably, through the Regional Extension Center, probably support somewhere between 5 and 8 different products. 7 of those, if we choose 8, we've never personally implemented. So I think probably our struggle will be, where do we back off? Because we've been so involved in, from day one all the way through the process, being completely involved with the health centers, and now we're helping in a consulting capacity, but where do we back off?
Yeah. And where have you made your money to cover your cost previously as a 501c3?
Well, our member centers pay a per user cost. So with our offerings, we offer not just the electronic health record, not just the practice management systems, but the full gamut of products. So all of it. So the practice management systems, the back office, Microsoft Office, everything that our health centers do, they can log in one place and get to everything they need, and it's all secure, it's at Terramark, and we do that at a per user cost.